Probably 20, 25 years ago when we first started doing interventions on our patients, coronary interventions, meaning the angioplasties, the ballooning, stenting, devices, the ability to access the arteries through a puncture into the artery, the catheters were bigger. And now, over time, our catheters have gotten smaller and smaller. That I would say in 2016, it's a non-issue as far as the technique and the technical aspects of it. I think it's true across the country. I mean, the catheters were really pretty big. When I was in training and starting out, and now they're not that much bigger than a large bore intravenous catheter. So we've just gotten better, but it's kind of what cardiologists do. Mm-hmm. They take a modality and they tweak it and refine it and make it more user-friendly and technically and a lot safer for the patients. And we did that with echocardiograms. The radiologist had this really great ultrasound technique that allowed you to identify different tissue layers and surfaces as you pass these sound waves through a body. And then in the hands of cardiologists, we made it have this three-dimensional aspect. Started with a two-dimensional aspect that really did look like a beating heart. And so, we've taken modalities, we've hijacked good ideas from other areas of medicine and just refined it and tweaked it and made it better. I really think that as we think about whole foods, I think we have to think about embracing changing the pace of the way we live, getting better sleep. I truly believe that good restorative sleep is so important for every aspect of health, be it coronary disease or preventing cancer, and definitely addressing mental health issues. So life needs to be simplified is, I guess, an ideal, but maybe just slow down a little bit. If you have a little bit more time, you can take your time in your kitchen to make the right meals. You certainly, if you're a parent, you want to be a really great role model for your kids. They need to see you enjoying a meal, certainly having a meal as a family. This is all a way of preventing not just coronary disease, but disease and fostering a healthful generations to come. It's all interrelated. The risk factors for heart disease are the same risk factors for cancer. So we really need to, I think, take a more grassroots approach to medicine. And prevention is absolutely the key. I love the idea that people are testing for prediabetes now. Like, we should be jumping on that disease before it gets out of the gate. And so the fact that with the Affordable Care Act, we have nutritionists and dietitians being reimbursed to be educational for their patients, to partner with them and prevent diabetes from occurring. So prevention is probably the most important thing we can do for our future. It is, and so that's probably the hardest piece, when you were asking, what do we need to do? I remember being at an American Heart Association meeting. It was more a planning, messaging meeting for what we need to do, and the idea of reducing fat and sodium in our foods was really, really important, and that we should start a low sodium diet at the age of 5, and encouraging more fruits and vegetables at the age of 5. And I remember thinking, how are we selling this to the public? Because you can't grab and go food now if there's not salt at the very foundation of some form of preservative. So it just seems like a challenge. That I think is going to be our hardest, piece. Taking on the restaurant industry and taking on the acquired palate of America that just doesn't want to have, they're missing that salt in their diet. But it's little steps.